He's our dog.
He's in down school with 5 class, and so English, and I mean, if you saw him, he looks like me. He's blue, I do blonde, but never.
But she cried.
He's close. He's done like along the border. He went with groups, you know, that where the therapy students go down Browns, whatever it is, and then in Texas, and then he thought that was off. He wasn't because he goes to in the city.
Yes.
Because he speaks Spanish, and he has an understanding patient. Well, you know, he was there.
Yep.
And
That's
so
awesome.
has a lot devoted ideas. They're like,
This guy.
I always
We can stand for the pledge.
take it in language. Should.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Thank you for joining us on this beautiful summer-like day. Feel so good to come out of hibernation, right? So first, if everyone had a chance to review our minutes, if we can have a motion to approve our minutes. Motion to approve. Thank you. Yes.
Dr. Brooke,
Yes.
Michelle,
Yes.
Robin,
Yes.
Sylvia,
Yes.
Terry.
Yes.
Thank you. Next board meeting is scheduled for June 3rd. I hope time slows down between to talk about June already. So that's next to put on your calendar, followed by our health fair and lots of exciting things in June. And next up, I'm going to bring up the report of our board because we've had some big things to report.
Thank you, Madam Chair. Unfortunately, tonight I am not the bearer of good news. In fact, I couldn't bear all the bad news, so I'm going to have Carrie and Linda help me carry some of the bad news. The legislature, of course, is done and gone home for a while anyway, and that has at least stopped some of the bleeding. But it's still going on, and we still have. I think it'd be unfair of me to say that we don't have serious problems. The good news, if there is any, is that you have two people here in the form of your chair and Carrie who are as much as possible on top of this issue. We met this morning with the auditor's office to get some insights into where they are vis-a-vis the local funding share of how we operate. And nothing, even though the legislature's gone home, nothing is yet final. So I think it's not going to be much different than the report that the three of us are going to give you tonight. But anybody who tells you they know what the outcome is doesn't know what the outcome is because it's a moving target all the time. I don't know where to start in terms of the process, but the easiest, clearest, most definitive element of our angst is the Health First Indiana program. In the day, it was funded at $150 million. And we were euphoric that Indiana had finally figured out how to deal with public health, and that's that you fund and pay for programming that facilitates it. Unfortunately, that euphoria didn't last long. The bottom line when the legislators left Indianapolis last week is that figure has been reduced to $40 million from 150. And we will experience a corresponding reduction in what we get. The formula may change a little bit, but basically, Carrie, what do we think we're looking at?
We're looking at just over $900,000, so like $902,000.
And at at funding, full funding at 150 million, we got 3 million.
3.388.
So we're going from 3.38 to $900,000.
So this is approximately a 73% cut in our funding.
And we're not magicians, and we can't print money in the basement. We're going to have some serious and tough decisions to make, none of which we're going to make tonight because we don't know exactly how this is going to play out. But probably next month you'll be told to come with your scissors, if not your knife, and we're going to have to start looking at some pretty serious cuts. There's also impact at the state level in two forms, in addition to that program. To the extent that we were the recipients of money that was a pass-through grant from the federal government to the state and then to the local, you don't have to be a genius to turn on your television and see what's going on in Washington. The party in control has now submitted their budget, and it doesn't get any better. More cuts, more slashes. But a lot of these grants that have been pass-through grants are gone. And we relied on them to fund the program. And if the money's gone, the program's gone, and that's where the tough decisions lie. And then also there were monies we got directly from the state in the form of grants that was state money. That was all cut out of when the legislature passed the budget. So at the state level, we've got some serious thinking to do. Our budget is due June.
So to the state, it's still due June 1st.
Okay.
Now that's just for the Health First Indiana portion that we are yet to know the exact amount that we have to plan for. And then to our county, last year it was July 1st. So at our June meeting, we will be looking to present a budget and have discussion and then a vote on what we agree to do. And for our part, just to kind of let everybody know, there are local grants that we are seeking to support specific programs. So, for example, we wrote for a grant that would support the elopement kits that we heard from Kelly about, that we approved to begin this year. One that would support infant car seats and that program, support our partnership for Safe Sleep with Mental Health America. So we are continuing to pursue those things to support those programs at those amounts, as well as we received one to support our Adolescent Supports and Knowledge Initiative in partnership with the HUB, the Tobacco Coalition, PATH, and Juvenile Justice. We also are exploring other means of revenue sources, so other things that we can bill Medicaid for, that we can do cash pay, things like that, so that we can increase our revenue, as well as looking at the programs. There are some things that we just hadn't started, so we won't be starting those things. So, for example, of course, we have our chronic disease prevention core service, or KPI, our core service and our KPI that we're working toward through adult obesity. So continue with those programs. However, the POCO Wellness Initiative, that's just not something that we're going to be able to support either with our funds as far as the portal, or taking the time and manpower to hand enter those things. And so that part of it, we'll just let go, and we'll promote everybody's programming that we're doing in partnership, and even programs we're not in partnership with, but that exist to promote those kinds of things. And so we're just really looking at every single line item. They call it braiding and weaving, our fund sources, and trying to come up with the tightest and best budget that we can while still providing our services, hopefully more services, and in partnership with.
Before we leave the state and look at what's happening to us locally, the state may not be done with us. If we go into a recession, the largest source of revenue for state funding is sales tax. And what happens during a recession? People stop buying cars and boats and big ticket items, and you're back to sales tax being what you pay on a Three Musketeers bar. It's not going to run much of anything. So if the projection, what was passed in Indianapolis was a 2-year budget. It is not implausible that they will call themselves back into session at the end of this year, looking at next year, and say, we've got to cut more. And what that will entail for us, anybody's guess is at this point. But that's another thing we've got to keep our eye on the ball. And it's impossible to plan for that kind of thing because you don't know whether or not. But you got to plan for the worst, I guess. And we're pretty close to doing that. And if this wasn't enough, simultaneously, we have property tax reform. You're going to pay $300 a year less in property tax, and we're going to be devastated in our local levy dollars that we get from local property tax as well. And that was what the meeting today was about with the auditor. The auditor's got to figure out how to do, all you hear now is you got to do more with less. You got to do more. Well, you get to the point where I don't know how much less we can deal with. So at every turn, every door we open, the room isn't full of money. It's full of holes. And that money has left us. And it's not something you like to report, and it's not good public health. But that's what it looks like. Linda?
Yeah, but just to kind of catch people up if we're new to this. So, we get a substantial portion, we've been getting money from the state, and then from the county, we get it from the tax levy. And so we met with the auditors today to discuss that portion of our source of income. And really on both ends from the state, we've guesstimated our number. The county, they're dealing with what we're dealing with times 100 with every single, county entity that they have to contend with. So there's so many moving parts to where we really don't have a bottom line as to what we're dealing with. We know it's not going to be good. We know it's not going to be good at all. But we don't know exactly where the bottom line is to be able to make huge decisions. But we do know that we need to tighten up. And so in the places that we can, we've already met to kind of start that conversation so that Carrie can start working on submitting those things to the state. All of these things will be presented to the board next month so that we can start that process of tightening up. When she presents the budget to us, it'll be last year, this year, what we project to do next year. So we will be able to look and see where we've spent, what we have, what we won't have, and this is what what programs, and that's what we're going to focus on right now are the programs that we're going to tighten up on, because those we know with HFI going down, that's the most common sense of where we start in terms of making our tightening up choices. So, I would say for those of us on the board, look, if you have a previous budget, look at your previous budget. If not, you can look online and see where we've spent our HFI funding, where our partnerships have been. Those all can't continue by any stretch of our imagination. So think about what is important to you, what you think is affecting the most people in our community, and we're going to really have to pare those down and see which ones of these things can we move forward with. And those are the parts of decisions that we'll have to be making in the next month. Everyone's trying to do the best that they can with the information that they have, but as Dave explained, it's like a moving target. Every day there's new information and new worries, and so, in speaking with the auditors, they were very thankful for the work that Carrie's already done in the monies that she has kind of laid out and what we've spent, what we want to spend, what money we're getting, what we need. And that helps the council a lot to know where we stand when they go back and look at where everybody stands and how they're going to be allocating funds because they are going to be affected by that property tax cut.
There isn't any sugar coating we can put on this.
No.
I think everybody on the board needs to leave here with the realization that we've got some very tough decisions to make.
But the goal continues to preserve as much of us as possible, to continue to produce the great quality product that this health department produces in the best way that we know how.
That's why we're here.
That's it.
Nobody ever said the job would be easy.
No, we got the fun part. Now here comes the hard part. So I said we were riding the wave, and now we're face planting in the sand. We'll figure it out.
You know, we're
Figure
gonna,
it out.
as Linda alluded to, we're trying to deal with it at the program level as we look at these, and you're talking about losing some awful good programs that we won't have the money to fund.
Would it benefit the board for me to send, a couple months ago, I sent the council per their request the state spend plan, but I made all kinds of notes about programs we hadn't started yet, you know, programs where we didn't.
That big thing. Yes.
Yeah, that would probably be a good thing for you guys to see.
So that they can review it. Yeah. And see, you know, because like we had stated we're going to do the such and such program. Well, it hasn't happened yet. And so that's an easy thing to hasn't even come into fruition. We budgeted $200,000 for that. So there were some easy things to go through. Some of these things are going to be harder because we are still held accountable to the HFI KPIs. They still want us to have our community partnerships. They still want all the things that they wanted from us at just with 73% less funding, but we still have to answer to those KPIs. And so, you know, this is where the balance lies for us. You know, we are still getting more than we did before HFI ever existed. And so, you know, we focus on what remains and positives. And we are in a great position as a county also and as a health department. We have been very conscientious and frugal with the choices that we have made with the usage of this money. We had a substantial amount, I think, $700,000 that we had left from the first year's funds. We have over $700,000 left of this year's funds. Now, I'm in a place that I have made it very clear to them that I'm in stockpile mode. When you tell me next year I'm going to make $73,000, 73% less, I'm going to start hoarding. And I know that's not necessarily the wisest move, but we've kind of done that to a little bit to give ourselves, we have some cushion for next year because of the wise choices that we've made this year. And that is good. And the county, I think, has made those types of decisions as well. But we don't want to burn through that, right? So
I mean, I don't think we should assume that that's.
we can't assume anything, but
money we have is going to be able to create a soft landing, but it's not going to solve the fact that we got to bring the airplane down and park it somewhere.
That's true. But we've done a good job so far. I'm proud of where we're at. I don't know if anyone has anything else.
Anybody want to?
I mean, ever since we got the money from the SB4, I mean, it was under the impression in my mind that it could change at any moment.
Absolutely.
I mean, we made that fairly aware to any of the organizations that we donated money to, that this was money that we weren't sure we were going to have long term, that every year changes, just like this year, unfortunately, not in the positive, but in the negative. So, I mean, with that being said, I think we've done a great job making some good choices as a board, supporting some really good organizations, and who knows, maybe some other, you know, businesses or other organizations might be able to step up and continue, you know, pass the baton on to.
Yeah.
So
In the short run, that makes it more difficult because we know we've picked good programs.
yeah, but you know, some of these things you never know that what they would have even become if we never even donated to them and saw the benefits that have become of it. So you kind of have to.
Oh, it's been great.
Yeah, you kind of have to take it as it is and just be thankful that we were able to make a difference in somebody's life, and hopefully, you know, one way or another, these programs, if they aren't able to be financially supported by us, that maybe some other way they will be able to.
Someday people will say, "You remember Health First Indiana?"
Back in my day. And I'm really happy too that we were able to do all the renovations with the health department, Carrie. So, I mean, I think that will make an that will last for
That
many,
lasts,
many years.
yeah,
Yes.
So,
Largely that was ARPA funding, but we did need
right.
or 10% the last
that
time.
was our capital of the 10%.
Correct.
So
And I know that the ARPA funds help with that as well.
And we've had some other grant funding that has helped out like that too. So, yeah, I mean, we've been able to accomplish some really exciting, great things. I think
Yeah.
that's what makes it bittersweet.
Right.
Because we were on a roll.
Wish it wasn't intense.
Yes, we were on a roll. But it is what it is.
Yep.
And we have no say in any of that. So,
As has already been alluded to, Carrie and Linda are really on top of this to the extent that you can be on top of this, and I'm comfortable in working with them that they are doing everything they possibly can to salvage the best of the best, and that's what we are. And I have every reason to think we will continue to be
I agree.
the best of the best.
Because of all those people back there.
Right. But I am a little tired of hearing you got to do more with
I
less.
know.
You got to do more with less.
It is getting old.
It does get it. Thank you.
Buckle up for next month. But we'll do our best. All right, so sorry to start off on a sour note, but we do have some new business with our Porter County Aging Community Services. First, we'll start out with the transportation proposal. Did you know any of that?
No,
You didn't. I'm sorry.
that's okay. I'll just ask for 119,000 instead of 120,000.
Yeah. Out of our 900.
Yeah. Well, I just want to say thank you for the opportunity to come back today to share about the updates. You guys were gracious to us last year to give 80,000, and I believe that we have provided the facts that we have done a really good job at making that 80,000 work for us. And you are absolutely right. You mentioned last year that the funds that were available then may not necessarily be available today. And we understand that in any grant world, right? So we never ever should build our budgets and our foundations on those types of things. So we completely understand and stand with that. So 80,000 that you gave to us last year helped us to purchase a couple buses. We had some buses that were not in good shape, and I'm happy to announce that we will be receiving 3 brand new buses at the end of this month. So we will retire 3 buses, and we also were hoping to get 2 more buses for next year, and that still may be possible. But we have purchased those buses, and we'll be getting those. But I think probably the most exciting for me is that we were able to serve over 2,000 more individuals because of that 80,000. That provided staffing for us, and that provided us to be able to fully staff our fleets. Transportation becomes a very tricky business line of work, if you will, but it's one of the number one requested services that are needed in our area. So we primarily serve individuals with disabilities, our seniors, the most valuable, vulnerable population, and 40% of our clients are dialysis patients. So because of your generosity in that, we were able to provide those individuals crucial services 3 times a week, Monday, Wednesdays, and Fridays. We also serve 20% of cancer patients. So because of your generosity, we were able to continue to serve more individuals that were needing to go for those couple of minutes to an hours of treatments there. We also serve a good portion of our Alzheimer's and dementia patients through St. Agnes. So again, those 80,000 contributed to that success of that growth of that number there. So this year we were asking for 120,000 if possible, and again we may not get that, and we completely understand that. And just kind of the breakdown of what that 120,000 was going to be for. Again, we were hoping to be able to provide 80,000 towards wages and benefits for additional drivers, to be able to staff those new vehicles, and then also with the cost of preventative maintenance, tires, brakes, oil changes, inspections, and of course fuel rising as well. We were hoping to secure 25,000 of that to go towards the preventative maintenance side of that. And then lastly, we were also hoping to switch over our scheduling system. As I mentioned last year, our scheduling system we use is called RICO. We were having some difficulties with getting some scheduling and some things like that. So we have merged to a new program called EcoLane, and we just actually kicked that off last week. And the idea behind that is typically it allowed us to schedule 15 individuals at a time during a time slot. This new program will allow us to serve now 25 individuals. So we're going to see a growth within that. And again, the whole idea is that it's going to analyze, it's going to help us to be able to take out some deadhead miles, some downtime so that we can be able to serve our riders a little bit more in that capacity. So we will definitely be able to serve more individuals, and our services are continuously always are needed. We get daily phone calls that are looking for rides to these appointments, whether it's dialysis, whether it's the cancer treatments, whether it's going to the hair salon, getting their perms done for that week, whatever it might look like for them. But it gives them the dignity and the quality of life to be able to continue to live life to the fullest in their final life. That they have here. So we have that privilege of being a part of that. We know that Porter County houses over 135,000 residents, and of that, of roughly about 30,000 of that population is considered to be 65 and older. And we know that every year goes by, that number will continue to increase, but we also know it will decrease just because of the quality of life and the circle of life. But we do know that there will be an increase, there will be an influx of aging as well, and also demand for our transportation services. So that's kind of a little bit of our proposal tonight. And so if you have any questions for me, shoot away.
First, I'd like to start by thanking you and congratulating you for the services that you provide, how you've wonderfully have used this money to provide services to the most amount of people possible with it. When we get these numbers back from you guys monthly, it is so exciting to see the tangible effects of what you have done. And then when you add in dialysis, cancer patients, oof,
Yeah.
you got me. When we started this process with this funding, we did a needs assessment, and the thing that came up over and over and over again was the need for transportation. So the fact that we were able to partner up with you and provide these services, I think was the best use of our funds that we were given. So anything going forward isn't a reflection upon anything that we think in terms of lack of need or the tremendous job and service that you have provided. I think we will now struggle with what we have available to us.
Right.
And I hope if there's any shortfalls that we have, that the county will find a way to make that difference up, because all of those things you proposed are necessary and important, and it's nothing short of heartbreaking to not be able to continue those services.
You can turn around right now, and there's a man back there who's shaking his head.
It's our county.
I saw him. I'm your witness. He was shaking his head. Yes.
I think everybody agrees. So we gave 80,000.
Correct.
My feeling, which I'm just one of 7, would be that my hope would be that we can continue a partnership. But I would be very hesitant to say that we can give any more than what we currently had given at this point in time. Even that, I think, is scary with us not knowing really what's coming forward.
Right.
But to me, this is a program that has been one of the most beneficial of the services we've provided and the partnerships that we've created. And if there was one to save, my vote would be for this.
Thank you.
But that's just one.
I think that it was great that you could help. They were in need, and what is great about it is we can see by the numbers.
Yeah.
It's like an instant gratification of
Yeah.
how it's been working. I'm very familiar with Porter County Aging. I'm on their board. I may be recusing myself because I know exactly what they're doing and that, and I just feel don't feel 100% comfortable in voting in money matters on this, but I can tell you it's a great program, and to see the tremendous gratification of the people that I witnessed them coming in, and I could see how beneficial it is to the county to have this. That you're spending your money well.
Thank you.
Any thoughts of continuing the amount budgeted?
I mean, I agree with you. I don't see how we can fund more than what we've been funding, but it is a program that has reached many of the elderly. And I mean, when you think about people that work their whole lives and, you know, Medicare doesn't really pay for them to have transportation, a lot of them don't feel comfortable driving. And when you figure people are getting taken to their dialysis, I mean, that's decreasing the chances of them going back to the hospital. Because if people aren't getting to dialysis, the chances of people being readmitted to the hospital for complications is,
Well, I mean,
yeah.
it's not compatible with life.
I'm saying.
So
So I mean, if you're keeping I mean, in my mind, you're keeping somebody out of the hospital by getting them to their treatment.
Yeah, when we think about the investment, you know, and our charge is to serve as many people in Porter County as we can, and this cuts across a wide swath of age, of, you know, issues with mobility. I mean, because I know I very often, you know, see kids who have a varied range of challenges, transportation challenges, and parents who can't provide consistent transportation. And so, you know, seeing how this $80,000 investment has really developed into such a wide, you know, area of help is just amazing. And so I think that, yeah, I would agree. I think we need to continue it at that level.
Thank you.
And I felt the same when I looked at it. I mean, the only question that I had was what we were going to do going from 80 to 120. That was really my only question when I read it originally. But I think the impact is huge, and I think it's definitely a necessary program that has reached many people. So I do find the value.
And I just want to say that when we have been crunching numbers this week, we tentatively had it at doable 80,000, and you know, it's very unfortunate because in the budget we had originally planned, because when
We wanted to expand.
to us last year, he discussed desire to expand into. We don't have a VA hospital in Porter County, so
Right.
individuals be transported to the VA hospital. There are no options,
No,
and so
this would be the only one.
that we had reached out and said, hey, you know, remember that you talked about that, and so we had really hoped to expand this. So it's very unfortunate.
Yeah.
And so that's why it would be wonderful if people are able to find another, because that is a huge need. You know, that the, you know, surgery services at the other hospitals that, you know, even though we might have Franciscan here or St. Mary's here, there are treatments, there are, you know, procedures people need to go out of county for, and so yes.
And we're still very open to hopefully going beyond the Porter County border to service those individuals. As you mentioned, you know, specialties, VA, and all that kind of good stuff. The additional funding would kind of help offset us from increasing any fees as well, because you know, we're only $1 one way, which is, you know, really unheard of. My board is kind of split. Do we raise it? Do we not raise it? And it's a conversation that we all just kind of just walk away and just hopefully it doesn't come back up. Because you know, we don't want
That's the mood I'm in.
yeah, you know, it's like we don't want to increase it because, you know, a lot of the folks can't necessarily pay for that. So a lot of times, even though it's going to cost you $1, you know, some of our drivers have even pulled $1 out of their own pocket. You know, I mean, it's just the nature of the work that we do, and also it's one of those things. If they can't pay, their life is so much more than that $1. So we get that, you know, as social workers, healthcare professionals, we get that dealing with people, but not everybody understands that. So, but our hope is that we can still be able to take those Porter County residents across the line, so that we can still do that. And we are actively seeking funding as well, donors, grants, so on and so forth, so that we can get that accomplished. So the 80,000 would still help us tremendously to be able to keep those operating systems and all those types of things going forward. And then we'll figure out the preventative maintenance and things like that. So yeah, so thank you for bringing that up, and thank you for reminding us about that expanding services.
And I would be only echoing what the other board members have said, that it's such a vulnerable population. You know, when you talk about dialysis patients, you know, to and fro, or cancer patients,
Mhm.
just meeting their needs, and such a great deal of
Yeah.
people are in need of that service. So
Yeah.
it's tremendous work that you're doing, and I love seeing those
Oh my
buses
God.
out
Yeah.
there.
Yes, I'm
It's
excited by
nice.
that.
Yeah, it's great to see those buses out. And Valerie, thankfully, she took the vision, and we were able to get our buses wrapped with advertisements, so that helped bring in some extra funding as well.
You're very creative. You're good. You guys are.
Yeah, well, you have to think outside the box a little bit. So I said we have blank canvases, they're moving billboards, get those things filled, and Valerie has always executed to the greatness of that. So, but yeah, so that extra, I think that actually brought in almost $30,000. So that kind of helped go towards the transportation as well. So that does help offset some things and some costs.
We're gonna all have to be more creative.
Yeah. Well, crisis creates opportunities, right? So that's where we are in this time of our life. So, absolutely.
So, if I may, I propose that we approve this proposal for the Porter County Aging and Community Services transportation proposal, but at the $80,000 mark, as opposed to the initial proposal. Yeah, just due to our
Understood.
scenario.
Understood.
Second.
Dr. Foster,
Yes.
Dr. Brunt,
Yes.
Michelle,
Yes.
Robin,
Yes.
Sylvia.
I'm going to recuse myself, but I'm 100% for.
Absolutely.
He's on the aging board.
Yes.
Understood. Sorry.
No, that's okay.
Terry,
Yes.
thank you.
We still have a quorum. We're good to go. Thank you for all that you do.
Thank you so much. We appreciate your support.
You would success.
Thank you. Best of luck to you all as you guys are navigating through this crisis. So, we appreciate you all.
We have another proposal from the Porter County Aging and Community Services for a chair yoga exercise program. And again, this is in response to the request that we made for community members for programs that increase movement and activity in hopes of us participating in this POCO Wellness program.
So this is still available for right now?
I think we'd like to hear it. And
Okay.
I think this is also fresh and new to us.
Yeah.
And we're beginning these difficult conversations, and so we certainly know that these proposals came in, but we just got this information.
I know.
Go ourselves. So we do have funding for this year, but it's just a matter of how much we're clamping down and how much the board feels is appropriate to continue to do. And certainly, I think what you've proposed is worthwhile and worthy of us to listen to, and then it's up for us to decide
Yeah.
what we in terms of moving forward.
So my proposal is pretty straightforward. It was just that we'd have we're doing more activities if you haven't seen us in our building, in our community room, using it a lot more often. And so some of the things that we're starting, one of them was going to be exercise classes, especially for people who cannot get out, can't easily go to the gym. So the chair yoga is great for people with mobility issues. They can just come right to our community room. We have plenty of space. We have a big screen TV. They're able to do yoga. We can all do it together. It's a great social outlet. It's a way to exercise, get some people going. I thought we would start with 2 chair yoga classes per week and then 1 regular yoga. If I see more of a need for the chair yoga, we might switch to that. But primarily my thought was to help people who can't get out and exercise, and we could be together, and have a support system. So, and then I have all the pricing listed. If you have any questions, I can answer any of that. I did find some really great sources for yoga mats, very cheap. So like $1.20 for yoga mats. So I can buy them with the fees that I put for the $500 at really good cost. So we could probably get some new chairs for the yoga. We have some. There might be better ones that we can get. we were thinking a minimum would be 5 people in the class. We could actually hold up to 50 in that room and comfortably. We've done it before for bingo and other things that we're doing.
I guess that was a question that I had. What kind of interest or what kind of numbers are we talking about?
Yeah, the minimum we would want to do is 5, but we already have like some women who meet for, they do bingo. It's just penny bingo, Mondays and Fridays. So of course we'd be interested in having them come and do more of a community outreach. I think that's probably, I mean, I don't know. I know there's Bonner where you can walk, but I don't know of a chair yoga program anywhere that is something that, and this is even better, where we can like pick them up and bring them to our building because we do have transportation. So it's definitely a way to help people who are having trouble getting out.
That's exciting, actually.
Yeah,
Well, the
I was
service of transportation too.
right. Yeah, because like, how are you going to get out and go to the gym?
Yeah.
And if you can't, especially you can do it in a wheelchair. You can come in and sit with us and have a good time, hopefully.
Who is the instructor?
So right now it's going to be Inga Nimitz. She's one of our older volunteers, and you've probably seen her before. But so we would have her do whatever we spoke to her about it, and then of course I'll sit in and train with her. But if she couldn't do it for any reason, then I can always step in. We also have other. We were thinking about possibly reaching out to Barb, who used to do our Section 8 housing. She's a very great at yoga. I used to do those with her. We had them in our building just for our employees. So those were our outreaches for right now. Waiting to see if we get approved, and then it definitely will be covered, no matter what.
Good.
I will step in if I have to. I need to do chair yoga
for you.
anyways.
Yeah. I think that's about the only yoga.
Have the document in front of you. What is the ask for that?
8,300 was it?
Right. 500 was for supplies,
And then the rest was for the
instruction. Yeah.
instructor.
Yeah. Mm-hmm.
And then are there any fees collected for the participant?
No.
No. Okay.
No. Yeah, we wanted to make sure we were able to do this for people who couldn't. You know,
Mm-hmm.
some people can afford to go to Planet Fitness, and some can't. If you're paying $1 to go to transportation, you probably can't afford to.
Yeah.
The cost per class was cheap.
Yeah, it's fun too. I mean, we all get excited, so I think it would be fun for us to go and help and be part of that too.
And just the $8,300 is for a whole calendar year. So I just wanted to point that out. So let's say it started into May, we would be looking at going through.
Yeah.
Do we have to do it for the whole
Or
year?
if the board wanted to just trial it until the end of the year and kind of decide where we were at with programming for next year. And
I am more comfortable with that then. Do the end of this year. We have so much unknown.
I know. I do understand.
Not to mention, I feel like that way we'd see how the interest is in it.
Yeah,
Right.
I mean,
definitely.
if that many people are interested and in participating, then I would definitely be on board. I mean, if 50 people are going to the yoga class, I would.
Can't say no.
Yeah, that sounds like a win.
That beats bingo.
Yeah.
And we could also advertise, have the drivers pass out flyers on the bus. We already have the people who taking our transportation service, so the advertising part of it would be very easy to put in place.
So would that be, Carrie, you think like 50% of this 8,300? Well, there's the $500.
for the supplies. And
That's fair. Like, yeah, there's no doubt.
pro-social aspect always gets
I do.
important to everything.
I know. I love that.
Important to everything.
Did you say that Inga was going to be one of the instructors?
Yes.
She's a registered nurse,
She is. Yeah.
just a fabulous lady,
Wonderful. She's
great
actually
way of
one of the best.
educating and
You know.
Do you know Ing?
No, yeah, I love I love the fact that you're providing transportation. I love the fact that it's free. I love that it's going to the, elderly who can't make it to maybe the gym or don't have a way to get to the gym if they got there.
Yeah.
I love that you're using employees you already have. I mean, like all of that sounds
Because I think
Very-
it also hits on the mental health aspect of reducing isolation, increasing social. You're saying, Robin, like the whole package of reducing anxiety and depression.
Absolutely.
Because that's other than transportation, right? Mental health was the one of the big categories that we're trying to hit with a lot of this funding.
mm-hmm.
So improving mental health in the elderly is a very underserved,
Right.
I mean, because a lot of elderly people, the only time they go out is if they're going to the doctor.
Exactly.
Yeah.
And
So to give them some sort of, or the grocery store.
Yeah.
But I mean, giving them another outlet to me is like priceless.
And
Especially a fun
chair
social
yoga seems to really be hitting
Yeah.
its stride right now.
Yeah.
You know, you hear a lot of people talking about it, and I actually do physicals and checkups for 65 and older patients, and I will tell you that I have a lot of elderly women who don't get out, who say their friends are talking about chair yoga. Where could I go?
Right.
So there's
that's
a,
awesome.
hey, Terry,
Now you know.
now I know.
She'll have a flyer.
Yeah, because when I did the same thing, like tried to look into it, and they do have it at the Y Portage, I think. But you definitely can't afford that if you can't.
Right.
You know, some of these women are driving.
Right. Yeah.
Yeah, it's tough for them.
You have an easy network to tap into.
Yeah.
So that,
Yeah, that's the best part. It's so easy to like, hey, I mean, the drivers that Jason was, they're wonderful people. So
Yeah.
they would be really supportive and talking to everybody.
The social aspect of it too,
Yeah.
because they'll sit and talk with me for a long time.
Yeah.
And you just don't, you know.
Yeah.
So yeah, I think that's a good thing.
Yeah, absolutely.
When we revisit this, you can come back with the numbers.
Yeah.
We can, take a look at.
do
the
you
success.
think you and all of us 5,000 is a fair amount for her initial investment of the equipment and to get us through 2025? Is that something?
I mean, I think that would come. I really do.
Because 500 would be the initial output just for the basic
For supplies.
for the supplies that you would have to have. So then that would be 4,500 about for the half of the year.
Would that sound?
Would that?
Yeah, it's fine. Then we can get it started, see how it's going.
And we can't then I don't want to overextend ourselves.
Right.
I
Because
hate
it's
the
like-
idea of starting something and then saying, sorry, it's all over. But, that's
Yeah.
the reality of where we're at.
Well, and I mean, if they're able, to pay for it at some point, I mean, depending.
Or they can go back to the community and ask for different outreaches
Sure.
with the proof of what we helped start.
Yeah.
Yeah, right?
Definitely we
We have to look at the
They can
silver
always
lining.
ask the council.
Well, there's that.
Silly.
Hmm? Know that.
Plus everyone gets cut, but hopefully that doesn't happen.
Well, and I think if you could also get some anecdotal evidence, not just of the physical impact that it has, but also the social,
Right.
emotional, and psychological impact. I mean, then it's like that is a great way to present it to other community partners to say, this is something that we're investing in our community to improve the life of everyone, So I think that would be great data.
Actually, a good idea. I could do like a mental health, social survey before and after,
Yeah.
and then maybe put it to Porter's.
That's not,
Having all that data really helps.
that is
We always need that kind of stuff to be able to send back and say this is
Yeah.
proof of what we've spent the money for and where the gain is from it. So doing that, I think, is wise on a multitude of levels for you, so that
that's
if we're not able to do anything more, that you have that data to be able to present to others
Yeah,
that would hopefully be able to pick up what we
I will
start.
That's a good
I
idea.
think that's the key, right? Is always having
Enough,
The data.
definitely.
And we're able to help with that too. Demetrius writes success stories about all of our partnership, and he is good with video as well. So we shoot video, things like that. So there's a lot of options for.
Yeah, we'll have him come do a chair yoga. 10,000
For you.
I've done a lot of different companies.
that would be nice.
Well,
Yeah.
add it to the.
Maybe it'll go viral and people know.
Very good. So I will propose that we approve the proposal for the Porter County Aging and Community Services Chair Yoga Program at the amended 5,000 amount to end at the end of this calendar year. The budget is to last for 2025.
I second that.
Dr. Foster,
Yes.
Dr. Brunt,
Yes.
Michelle,
Yes.
Robin,
Yes.
Terry. Thank you.
Thank you.
Thank you so much.
Thank you.
Okay. That wasn't too painful. Old business. Anyone have any old business to share? Do you have any more for your report?
You've heard enough from me.
Okay, yeah, we definitely did. The claims and receipts have made their way around. If we,
That was
and I think we've all signed, if we can have a motion to approve our claims and receipts, please.
I move to approve the claims and receipts.
second.
Dr. Watson,
Yes.
Dr. Brunt,
Yes.
Michelle,
Yes.
Robin,
Yes.
Sylvia,
Yes.
Terry.
Yes.
Thank you.
Thank you. And we move on to the reports of our committee staff and health officer. I'll let you guys choose your order of presentation.
I do not have anything else this evening unless you have any questions for me, Dr. Kima. Do you have?
No questions. No, I don't. I do not. I do not.
Anybody?
I can tell you I thoroughly enjoy all of the reports. They get more, there's more pictures. I enjoy all the school liaison information is amazing. Your outreach programs are tremendous. I can't thank you guys enough for the quality of work that you guys do and provide to our community. It's really exciting what you've been able to accomplish.
They're amazing and they get crafty every day.
They really do.
Watch how crafty we're going to get.
Okay, I'm looking forward to it.
No, it's really fun too from the perspective of an instructor. I have a class that I teach. It's called Professional and Ethical Issues. And a part of what they do is looking at possible careers, right? Not just in mental health, but in public health, in public service, in human service. And so it's fun when I have these reports and I can say, like, did you ever think about doing this kind of work, right? This exists. And a lot of my students are like, I didn't even know that was a job. And I'm like, well, now you do, right? So thank you for providing me that I can then provide on to students who may not have even known that was a career possibility. So I try to bring up as much as I can opportunities, right, for people to serve their community. So thanks for doing that.
Anything else? Okay. Any miscellaneous? It's there. Okay. And if anyone has any public comment, I I wouldn't let you get away without it at this juncture.
So see how I would.
I don't envy where you're at. I do want to make that I do want to make that public assertion. You guys have been so supportive and so
Oh man.
amazing to us. And
I have to speak now. It was pointed out, but I'm not going to point at the man who said it.
and I'll give you free reign.
Well, I do that. I met with Carrie this morning, and I talked with her before, and basically, I'm going to go out on a limb here, a really very extremely long, and told her that I would do everything with my being one of seven. That's my phrase, by the way, Dr. Boxen. You can't use it as trademark. Being one of seven, even though I'm president of the council, I'm still one of seven. And I was just talking to Andy Bozak, his wife's and we're trying to hammer this thing around so that, as I said to Carrie this morning before, I will do everything I can to make sure that her department is running as close as possible to what she did in 2024. Our 2025 is coming 2026. Whatever that takes, she knows she's going to have to cut here and there. She's got a pretty good handle on it. I'm grateful that she's in the position she is. Thank you, madam. And I think a big shout out should go to her, not only her, but her staff that works very hard with her. To the board, yeah, you're right. We've got a very, very heavy road to travel. We're trying to figure out how to do this. We're going to have weekly meetings starting in June, and we're going to hammer this out. But rest assured, we're going to keep the lights on, and I don't plan on losing anybody. And that's the limit I'm stepping out on. And whatever we got to do that, I'm going to push and not stop until I get three others where we're going to go in that direction with me. So, thank you for everybody, for everything that you do.
Thank you. We appreciate that. Anyone else? Motion to adjourn. All in favor say aye.
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 Are you again?
Yeah.